Okay, right folks, we're now going to look at sit to stand, which I think is actually the most common moving and handling task that carers actually do with people, whether it's in the hospitals, whether it's the community staff, or whether it's with family in their own home. The other thing I would like to add to that is, particularly in the care industry, is we also know that it is also potentially one of the most potentially dangerous. It's about somebody sitting here and then standing up and that gap there. So we will have done the risk assessment. We know what Lisa's capabilities are. We will have looked in the documentation, or we may have asked her, or we may have gone through a few little exercises just to make sure that we know what her ability is in standing, okay? Because we have to know that, or we're going to ask the staff that we work with. Remember that a lot of people in the hospitals, their ability is also variable. So what they're like in the morning is not quite the same as they're like in the afternoon. You know, they've had a lot of work, maybe the physios have been and done some work with them and they're tired. So please take it on a variable throughout the day. So we're going to look at the best way to get somebody in a sit to stand, and I'm going to say, Lisa, could you stand up for me please? Okay, thank you very much. Thank you. We'd like to sit down again. Thank you. So we'll look at that in a little bit more detail in a minute. Now the other way that you could do is what I call a positive reinforcement. If you know somebody likes tea or coffee or a certain piece of cake and you want to get them to the day room, you might say, oh Lisa, there's some Battenberg with a cup of tea. Would you like to come with me? Oh, that's absolutely lovely. Thank you. I have kept hands off. Thank you. I'll just sit down again. Thank you. However, sometimes with all of the positive communication, people not might understand, we have to think about the two tools of facilitation. First tool is our tongue, and the second tool of facilitation is our hands. Okay. So we're going to look at this in a little bit more detail. So I'm going to ask Lisa to do the natural pattern of movement, and I know that some of your clients will be maybe not as quick as Lisa, a little bit slower, but the pattern will still be the same. Thank you, Lisa. Okay, thank you. Yeah, lovely. Let me sit down again. So she followed the principles. So basically she started to lead forward with her head. Okay, when she started to lead forward with her head, she was then able to bring herself forward close to the edge of the chair, thinking about that as the lever effect. She was able to use the arms on this chair. And when she come forward, then she led up with her head, pushing her weight with her legs, okay? Right, so what we're going to do now is, if she can't do that, I'm going to have to help her. So if I'm talking to Lisa, I'm making sure that I'm looking at her in the front and I'm still keeping my posture as well. Okay, so Lisa, we're going to stand up. Okay, thank you. So what I want Lisa to do is to actually lean forward. So I'm going to ask her to lean forward. If she can't, she might need a little bit of help. And this is where I'm going to put my hands on. So I'm going to encourage her. My hand is going to go on her back, down her back towards her hip. To get me down here, I have to bend my knees, so I'm helping her that little bit further forward, okay? That's hard for Lisa to stay like that. But she's now getting ready. To help her, I have to get myself ready. I come at an angle, I have my foot where her bottom is, and I have my other foot at a diagonal angle, fairly level with her feet. So when she stands up, she will be balanced. I'm going to put my hand either, depending on what she needs. Oh, yes?
It's going to be really difficult because my bottom's right at the back of the chair. It needs to come forward slightly to make it easier to stand, otherwise you're not going to get me up.
Right, okay. What I'm going to ask Lisa to do, see if she can help herself, is can she bottom shuffle towards the end of the chair? I put my hand here and okay, you go there. See, if she can bottom shuffle to the edge of the chair, yeah? Is that okay? So when we're talking about suitable and sufficient, maybe we should have looked at this equipment. Is this the right chair for Lisa? Is there another chair? That is a question that we have to ask. Now I can get into position a little bit easier and she's in a better position. So my foot is coming where her bottom is, level with her. This hand is either going down to her lower back to help her or aiming towards her hip if she needs that little bit more help. I am touching ever so slightly because from too far away she will feel unbalanced. This hand will go supporting here. There is an alternative as well. I'll show you in a minute. So I'm going to ask Lisa when she is ready to initiate the movement. So when you're ready, Lisa, we're coming up and we're coming into standing. I am close so that if she is a little bit giddy and a little bit wibbly wobbly, then all I have to do, the chair is behind her, is I just encourage her to sit down, following through. Okay, so this is what I call the forward facing sit to stand position. Thank you.